Hello. So here we are with this lovely woman, and she has had a face neck lift. She also had a brow lift, an upper eyelid lift, and a lower eyelid lift. And so it's been about 3 months since the biggest part of that surgery, sure. And here we are. So about 3 months, things have nicely settled down, and I think patients sort of have a pretty good sense as to kind of where it's going to come to rest. There could be the slightest resolution of some tiny bit of swelling here and there, but by and large, this is kind of where it's going to be. And so we thought it was a great opportunity to talk to this wonderful patient and get her impression on. You and I were just talking here a second ago about, she's interacted with family, like sisters-in-law and stuff like that, and sort of how they're reacting to her. So tell us, how's life? What are your thoughts?
First of all, I feel really good about myself. I mean, it's not just a facelift for others to think I look good. It's just for me. I had to do it for me. All my life I suffered with big circles and bags under my eyes, and I was very self-conscious, and there were a lot of comments made to me along the way about that. And I always thought if I ever get to the point where I have the wherewithal to get my eyes at least taken care of, that's what I was going to do, because that was my most self-conscious part. And then I came to you, I think it was last May or June for my first consult. So here we are, we're not even a year later, landed up being, even though I was hesitant about the procedures, I did get the upper and lower eye lift done first and the brow lift. And then when I saw how that was going, and I was just looking at my face, and with just my neck, and I had jowls, just real bad. They were hanging down, the laugh lines or whatever you call the area.
Marionette lines.
Really bad. So I thought, well, okay. So I tested the waters with Dr. Leong on the upper part, and I'm very happy. I was hesitant at first because it's scary. You don't know.
Sure
I mean, not everybody, you don't do this every day. Well, I don't do this every day. And then we started talking about the facelift. I brought it up to you, and you gave me the pros and cons and everything else, and I decided to go with it. I put my faith in you, because I know you're very good and, well, excellent.
Thank you.
I did my due diligence before I made my first appointment for the consult, and I saw you were double board certified. So of course, having done my research, I felt comfortable at least scheduling a consult back last May or June. So after I did the upper part of my face and I was not happy with this part in my neck, I scheduled the facelift with you, and I'm so happy I did. The recovery process, there's some, the first couple nights are sort of bad, but other than that, it's mainly, you're dealing with, it's not pain, you're dealing with more tightness, tightness. You just want the tightness to go away, and it has. I have a little residual, still a little bit in my neck.
Sense of tightness.
It's just a little sense of tightness.
90 days out, that's super classical, You'll find it might even be, we tell patients, it might even be 5-6 months before, you're going through life and you're like, you almost forget, like, oh, that's right, I had a facelift. You also forget sort of how you looked before. I will show you a picture of how you looked previous to the procedures.
And you have. You have.
Yeah.
There's a little bit, I can't believe it. I just can't believe the change. But that's from my perspective. As far as being around other people, like my sisters-in-law, brothers-in-law, 2 of them did know I was going to get the work done, and they can't get over how beautiful I look, is what they said. The other 2 who didn't know, I can tell they're just looking at me like, with this real pleased look on their face, but they can't quite figure out why. So I haven't said anything to them, but so it's obvious that you've made a big improvement in life. Well, I don't want to say everybody's face is different, but I'm very happy with my results. And when I think back on the recovery process, it's not a picnic the first few nights, but after that, it's really not a bad thing. You just got to be patient and just roll with it. Let one day go into the next, and it slowly improves.
That's right.
So I'm very happy I did it, and I would do it again.
Beautiful. That those words are better than I could have possibly have said it. This is a lovely thing for us, because look at this wonderful lady. Clearly, she's a kind heart. She's a good soul. And so, does anybody need this work that we do in this practice? As I just said, most Americans, go to their grave without having had a facelift, and they're fine. But I think I think there are people who are come to recognize that there are, especially if you pick the right provider, very important, extremely important. We've done a huge number of these things, and we've done very well in terms of not having, serious complications. We've done very well in terms of not having people look pulled or anything like that. We really hate that. And so ultimately, I think a certain percentage of Americans, or people anywhere, are realizing that if you pick the right provider and you have appropriate procedures done at the highest level of quality, it can be pretty predictable. A couple of days of downtime, not a couple of days that are it's fairly like a workout the first 2-3 days. We tell patients this. It's not as bad as most people think, but it's not a cakewalk either. There's a few days where you feel real beat up, but then it steadily gets better after that. And then what we love is to be able to show you before and after pictures where you can see the result there's a tremendous change. But then when you interact with family, you're having a dinner party with your family, and they're looking at you, and it very much looks like you. It looks exactly like you, but perhaps rejuvenated.
Right.
15 years, 18 years, something like that.
And two, it's almost like, I don't know how to. It's for me, it's like a mental health kind of quotient or whatever.
Mm-hmm.
Because I was feeling bad about myself, and I know that's, I'm not vain or anything like that, but I really was feeling like bad about how I looked, and I didn't have as much energy. I felt like I'm more energetic now, and it's just a mental boost for me. And like I said, I did this for me, not for anybody else anyway.
Mm-hmm.
So
that's the best motivation.
It's very much helped with my outlook on things. I don't feel as bad about myself, and I just feel more energetic.
Mm-hmm. That's great. That's great. The again, I'm super glad, better than I could have said it, and I'm glad you touched on that. I think a lot of our patients, when you strip away the layers as to why they're doing this for themselves. That's the best motivation. And do they at some, call it superficial level, just want to look better? I mean, yeah, that's not a wrong thing. But ultimately, I think what the real boost when we do, a terrific, a facelift like this, or a rhinoplasty, or something like that, it's not really that layer. There's a deeper layer. People, for whatever reason, it's not that they're super self-conscious about things. It's just that they don't feel like they're their best selves. They feel it kind of gets them down a bit. They're looking in the mirror, brushing their teeth, and they're like, "What a drag." I have the turkey gobbler under here, or I have the big bump on my nose, whatever it is that's bothering that person. And then when they're able to take care of that, when that is like poof, up in the air, and that's no longer a consideration, they have a bigger spring in their step. They're like, when I go on that vacation down in Florida, I'm gonna just, I'm gonna completely, more so embrace that experience.
Just I feel more confident.
You feel good about yourself.
Right, and that's probably the biggest part of what I'm happy about.
Mm-hmm.
But definitely, you have done a wonderful job. I have no complaints. Everything's for the good. So whatever few other things I may want to have done, this is where I'm going.
Okay, good. Well, listen, I hope you're able to tune in and listen to all that, because this conversation is what makes our work here meaningful. This is what it's all about. So I appreciate your time in watching this, and you can take a look at the before and after pictures yourself. Thank you.